Yeah. Hey, I'm live. Remar nurses, I thought that the computer shut down. Oh, we're here. It's Monday Motivation. It's Let's Talk NCLEX. This is going to be a critical episode that you don't want to miss. I myself am going to be very transparent with the Remar nurse community today for Monday Motivation. I'm just so happy that you guys are here. One of the things about Remar Review that makes it so super amazing is the community that we have every Monday that gathers together. If you're on this journey of passing NCLEX, it is mission critical that you get motivation, and also the other half of the show, Let's Talk NCLEX, is amazingly essential that you go over these NCLEX questions with me on Mondays. And I appreciate the questions because most of the time they come from the community. So if this is your first time watching, this is Let's Talk NCLEX and Monday Motivation. Hi. My name is Regina MSN. I happen to be the #1 NCLEX instructor on this planet, and you will get to see some of the way that I love to teach my #1 nursing students here at Remar Review. Hello, Remar family. Good afternoon. It's afternoon where I am, the East Coast, but I know I have people joining me from all over the globe today. Hey, I have to let you guys know that we have a podcast. It's called Remar Radio, and we drop episodes every Thursday. So if you can't get enough of what we do here at Remar Review, check out the podcast, because what we're doing now is, if you miss Monday Motivation or Let's Talk NCLEX, we upload every episode to the podcast on Thursdays. And we also will be dropping exclusive content on that podcast only. So check it out. You can get it on iTunes, Spotify, Apple Podcasts. Super simple, easy to download. And as I'm speaking, I get another testimonial. Hey, Nurse Davis, she says, hello, I passed my boards in 75 questions. Thanks to this community, you have blessed me to become a part of 1/24/2019. I officially am a registered nurse, Regina. You are truly an angel here on earth and inspire me every day to walk in my purpose. I cannot thank you enough. Okay, Nurse Destiny, I love that testimonial. You graduated at the beginning of the year, 2019. What a great gift to give yourself for 2019. The rest of us, we are on the way. We are right behind you, just steps behind. Actually, we are actually in a season of testimonials here for Remar Review, because we had nurses that took advantage of getting their program during Black Friday, during 7 days of NCLEX. And so now they're testing here in March and they're getting their license. So definitely the testimonials are welcome. Nurse Felicia, you says graduate, you said you're watching me on vacation in Africa. So Nurse Latanya, you says, oh my goodness, a podcast too. Now my husband says that you control the radio too. I'll control your radio if you're studying for NCLEX. I'm trying to tell you, when Team Remar said we were taking over the globe in 2019, we are on a mission to be the #1 nursing education company on planet Earth. And it's happening for us. You guys wouldn't believe it. So suggestions, what package do I need to study? Well, now that you brought it up, I have to show you guys the package that I love. It is the DVD self-study package. You guys who are Remar regulars, Remar nurses, you know that this package you can get on the website remarnurse.com. We changed the website. It's remarnurse.com, because that is how popular just the term, the identity of Remar Nurse had become. We just had to change the website. So it's remarnurse.com. And with the DVD package, you get 6 weeks of NCLEX material. And when I say NCLEX material, it's not just random NCLEX material. It is the things that I cover when I do my live NCLEX reviews. So it's not just DVDs that you listen to, but you have books that make the package complete and also very good for any kind of learner, because the DVDs are great for visual learners and auditory learners, but the books are traditionally going to be the most important component of the learning because you're actually doing something. So if you're a kinetic learner and you'd like to learn through actions, that's why we have the workbooks for you. So you get the student workbook that you take your notes in when you're watching the DVDs, and you get your quick facts, the 5-star quick facts for NCLEX. And this is your question and answer book. And then also you get your activity book and you get your homework book, because there must be homework. Hey, Nurse Marie says, this is my first time getting my self-study in today. I'm a repeat test taker. I have tried so many resources and it's just not working. I was told you might have something that I'm missing. I do. I am not a great test taker. So excited. I'm ready for this 6-week course. Let's do it. Absolutely. If you're a repeat test taker, this is the program that you need to have. Again, we've had phenomenal success with this program. Let's get back to the programming today, which is the Monday motivation, the disruption. Okay. We're talking about disruptions today. And I think this is going to be applicable to all of the 200 Remar nurses that are watching today. So the question that I asked myself when I was preparing is, why the disruption? Why the disruption? And let me do it, Mark. So I want to tell you guys a little bit about myself, but I have this announcement to make first. Again, you guys, we are paying for NCLEX. We are paying for NCLEX. One of the things that we also set on a mission to do is to invest back into the Remar nurses. Now, we do this a lot of different ways throughout the year, but every week for the rest of 2019, we're going to be paying for a Remar nurse to take the NCLEX exam. Yes, you guys know we are serious about the things that we say. So we'll be picking a Remar nurse. Oh, yes, Nurse Jessica, invest in yourself. Yes, I passed on my 8th attempt. Yes, you did. So we're picking nurses who invest in themselves, purchase the DVD package, and we will actually take over your NCLEX processing fees. So that $200 or that $200 that you pay to take the exam, Remar is going to pay that for you. Okay. So our next future Remar nurse will be announced at the end of the broadcast. At the end of the broadcast. I didn't get anything from you in the mail as of yet, Nurse Aldith, I don't think. So just let me know. Okay. So back to the segment. Why the disruption? Why the disruption? This is Monday motivation. I'm about to serve it to y'all right now. So a lot of you guys don't know this about me, but my ending up being a registered nurse was not an easy task. And so when I'm speaking to you guys, trying to motivate you all, I am coming from a place of realism. All right. It's not something that I'm making up. I have struggled. And let me tell you this about myself. When I got into college, in the beginning of my college career, I did not take my education very seriously. I mean, I'm just going to be honest with you guys. When I got to college, I had been blessed so tremendously that I was a tad bit ungrateful and very, very not serious about my studies. Let me show you some pictures, okay? We're talking about disruptions. So imagine myself, I'm in college. I have a scholarship. I have a full academic scholarship to college, right? Amazing blessing. I got a full academic scholarship to a major university, and I'm going there with the intention to be a nurse. That's what I wanted to do. I was trying to get in nursing school. But when I get to college, what happens to Regina? What happens to me when I get to college? Am I focused on my studies? Am I doing what I'm supposed to be doing? Am I going to classes? No, I'm not doing that thing. So here's a picture of me in college. I'm having a great time with my friends. And it's nothing crazy. I'm not drinking. I'm not doing drugs or anything. I'm just not serious about my studies. I'm going out with my friends. I'm not going to classes. We're having a good time. We're dressing up. We're getting fancy. We want to be seen, all these things. And I'm not discounting these girls. I'm just talking about myself. They just happen to be in the pictures. Anyhow, so something happens. All right. Something happens to me during the first 2 years of college. I say to myself, well, college is cool and all, and I'm having a great time here. My grades were really terrible. They were really bad. But I say to myself, even though I want to be a nurse, I'm going to stop going to college for a while. An opportunity presents itself, a false opportunity. And some of you guys know what I'm talking about when you have opportunities that look good on the onset, but you get into them and you find out it's not at all what you thought it was going to be. So for me, I had this opportunity that was a total disruption, right? And I'm talking about me leaving college, going to work for a major company, thinking this would actually be better for nurse. This would actually be better than nursing, this opportunity, right? Even though my heart was set on being a nurse, I left that to do something else, right? So I dropped out of college for about 5 months and I was working for this major company. And let me tell you, it was the worst experience of my young adult life. I mean, I was going to work every day, grinding very hard, but because I was not in my purpose, it was so taxing on me mentally, physically, emotionally. I literally thought to myself, why am I not in nursing school right now? What am I doing here? How did I end up here? You ever wake up some days and you're like, how did I end up in this place? How did I end up in this situation? So I had a disruption. On my path to nursing. And the reason why I had it was because honestly, I wasn't serious enough on the front end. I played around. And so I made a detour into something even worse that got me really off a track. And so in your life for Motivational Mondays, I'm speaking to somebody that is in a disruption. And you're in a disruption. Maybe you're in there because of your own actions or your inactions. But I want us to stop and think about why we're in the disruption we are right now. What is the purpose? So the question was, why are you at a holding point on your journey? What has happened to lead you here? And more importantly, because I had to do some self-reflecting, I had to think to myself, okay, why am I here? What caused me to be here? And where am I ultimately trying to go? And I came to the realization that the disruption that I was going through was needed to help me to develop the journey that I would eventually be on. The person that I was during the disruption had to change. For myself, I wanted to be a nurse. I wanted to get into this highly serious, highly structured profession, but that girl that I was in college was not ready for that. That girl, and God knew that. God knew that I was not prepared to enter into a nursing curriculum. God knew that that girl that I was then could not sit in this seat today. So I experienced a disruption to help me develop for the person I needed to be. And so you guys right now, during the disruption process, It's about the development. You can't look at it as, oh, this disruption is one big distraction. No, it's a development process. And so for me, my disruption, working at that job, oh my goodness, going to work every day, not being a nurse, helped me to develop my character. Okay, it helped me to learn that sometimes during the journey, I will have to get up and do things that I don't feel like doing during the process. All right, the disruption that I went through helped me to develop my patience. All right, helped me to develop my gratefulness. I got up some days and I'm like, I had a full scholarship to college and I left it to make $8 an hour. What was I thinking? You know, how ungrateful was I? It also helped me to develop my endurance. Not only just doing things one time that I didn't feel like doing, but consistently getting up every day, doing something I didn't want to do, helped me to develop a characteristic of getting it done. So now in my life today, I'm able to apply those same principles that I learned during the disruption to this. And it's so much easier because I actually love doing this. Yeah, it's about the development. Absolutely. You guys are going through a development process right now, whether you're taking the 6-week challenge or you're on the 6-year challenge. This time where you're waiting to become a nurse should be developing a character. All right. And if it's not doing that, then you have to ask yourself, why not? Why not? Right. So that's a little bit of me being transparent about how I got into nursing school, the process of it. And there's so many more details. But let me tell you, when I realized during my disruption, when I matured, because it was really a maturity process for me, when I matured and I got myself out of that situation, I committed 120% to my goal of becoming a nurse. And I'm telling you, when I got back to college, I cleaned up my act. I didn't even have no more friends. I really said, y'all don't look for me because I have to get into nursing school. And I had applied to a very competitive nursing school. I mean, even though my grades had got cleaned up, they weren't where they could have been. And so when I turned in my nursing school application, I turned that thing in with prayer, and I turned that thing in with just total gratefulness, right? And actually, out of all of my friends, I was the only one to get into nursing school. So when I got back to nursing school, I was hardcore. I mean, y'all see me. This is pictures of me in nursing school in clinicals. And I mean, I was on that mannequin. I went to teachers' hours. I went to my professors. I said, I'm supposed to be here. I was so grateful. I was so grateful to be back on the right track. And so it's a story of love, but in the end, the disruption helped me to develop my character. And so this week, while you guys are on your journey of studying for NCLEX, look at it as character development, because when you become a nurse, you are certainly going to have an inner foundation that needs to be built up. All right. So amazing testimonial from myself, just how really, it's the way that you want to look at every situation. And our brains are programmed to give us evidence of what we believe. And so if you believe that during this time you are developing a character, you are going to be an excellent nurse, you are going to endure, you're going to persevere, your body, your brain, your beliefs will give you everything that you need in order to sustain that positive thought. But if you're believing that you can't do it, you don't have time, you don't have the resources, you're going to find evidence of that as well. So let us stay motivated this week to know that the disruption is a development process. All right. So, all right. I love this. All right. So that was your Monday motivation. It was served. Now we have to get into a little thing I like called Let's Talk NCLEX. I want to start it with a question that I got. It was so good. It's Ask Remar, okay? Ask Remar. And so I got this email from a lovely lady. Hey, Nurse Booker. All right. She says, Remar here. Trust the process because it works. Watch the videos, do all of the workbooks, etc. because it pays off in the end. I never would have passed NCLEX on my third attempt if not for Remar. Thank you so much. Thank you so much for sending that encouragement. All right. So this question I got asked Remar. She says, hey, Regina, if a patient is in the psychiatric unit and wants to vote, can they do so? So good. I mean, so good. If you have a patient and they are involuntarily committed to the psychiatric unit, but they want to vote, are they able to do that? What do you guys think? What do you guys think? Can a patient who's in a psychiatric unit vote? What do you think? I just loved it. I mean, we love getting you guys' questions, but I love to see the dialogue here. So, all right. So I got some yeses coming in. Got some thanks, but yeses. Hey, if you're just joining us, we're just starting. Let's talk NCLEX, and I positioned a scenario that I got from a student that said, "Hey, if a patient's in a psych unit and they want to vote, can they do so?" So here's the answer for everybody that participated. It's a really good one. Here are the notes for this. The basic principles of federal due process require that a person's right to vote cannot be taken away without the opportunity to be heard in court. So fundamental for nursing professionals to know. The decision that a person lacks the competence to vote cannot be made by a long-term care facility, hospital, or other service provider, or by a guardian or a family member. Isn't that interesting? And when I was actually doing the research on this, and I love the research, I love it. It said that patients can have a hard time, like even a patient can have a hard time grasping their diagnosis, their medications, their reality, but they still can understand the process of which voting for a person works. And so it is a huge no-no for a registered nurse, or for a registered nurse, because that's the context that I believe NCLEX will ask you taking the exam in. Can a registered nurse prevent a inpatient client from voting or from doing some other Bill of Rights task? Like, the answer is going to be no, because the person has to be deemed incompetent to understand the voting process in order not to be allowed to vote. So again, even if somebody is in inpatient holding for suicidal ideation, homicidal ideation, they still, because it is a government right, they still will have the right to vote. And so, that is so good. And it's not even our discretion. Like, as registered nurses, it's not our discretion to even want to take that away from a client, okay? To even want to take that away from the client. So thank you guys for sending me in questions that make me go, make me think, make me get out the legal nursing books and all those things, because I really just love it. And it does add to the value of our community when we share. So let's talk NCLEX. Are you guys ready for a question? Are you guys ready for a question? I need participation. I need buy-in today. There's 400 nurses here on our segment today, and I just want buy-in today from you guys. Let's do some NCLEX questions. You're not going to want to miss these. Also, if you guys know that you're testing for NCLEX really soon, please participate. Also, please take notes. Some things you might learn today while we are studying. So let's do it, everybody. Let's get into this. Our first question, here we go. A nurse is working in the emergency room 4 clients are present at the same exact time. Which client should they assess first? Prioritization question. Here are your patients. Number 1 is a client who is scheduled for an appendectomy, rating pain 10 out of 10, with a white blood cell count of 20,000. 2, a client who has a broken ankle with no malformation of the foot, rating pain 10 out of 10. Client number 3, a client with HIV complaining of a cold, coughing up yellow mucus that is clear. Or 4, a client who was diagnosed with DVT 3 days ago, reporting pain and warmth in the affected extremity, rating pain 10 out of 10. So our 4 patients here, I see the answers coming up. Thank you for participating. We got 4 patients. The first one is a client who is scheduled for an appendectomy, rating pain 10 out of 10. The white blood cell count is currently 20,000. You have someone with a broken ankle, no deformity, but also rating their pain a 10 out of 10. Number 3, we have a client with HIV who has a cold and they're coughing up yellow mucus that is clear. And then the final client here, which a lot of people are going with, is this client who was diagnosed with a DVT 3 days ago, reporting pain and warmth in that affected extremity, also rating their pain a 10 out of 10. So in normal NCLEX fashion, we can usually get it down to 2 options, right? We can usually get it down in 2 options, and I see that reflected here. Most of you guys, well, half of you guys are picking number 1, and then half of you guys are picking number 4, which I agree. Out of the 4, I think these are the most common 2 that nursing students are going to whittle it down to. So let us break down these patients together, shall we? All right. So when I do a priority question, I try to figure out exactly what is happening with that patient right now. I don't try to infer. I don't try to project things that could possibly be happening, but literally what's happening with the patient. So let's break down patient number 1. We have a client who is scheduled for surgery. So they're scheduled to have their appendix removed. So that means that the treatment process has not been completed. This person to me is unstable because they're waiting for a surgery, right? They're waiting for a surgery. So this is an unstable patient here. Also, they're in severe pain. I don't really too much care about the pain, because if you need to have your appendix taken out, then your appendix is going to be causing you some pain at the time, right? But the client also has an irregular laboratory value, right? Their white blood cell count is 20,000. All right. What's the normal white blood cell count? This is basic fundamentals of nursing. You got to know your laboratory values. So thinking, this patient, right? I got you, Natasha. It says this patient is scheduled for an appendectomy, but they have not had one yet. So their main issue is still ongoing and hasn't been resolved. Let's look at the second patient. The second patient, and I'll just make it big here. So the second patient, they have a broken ankle with no deformity of the foot. So I'm looking at this client and I say, okay, so I know exactly what your issue is too. You have a broken ankle and you're complaining of pain 10 out of 10. I kind of think that the pain is going to be isolated to the ankle and nothing else. So to me, this client is not all that unstable. 3, we have a client, now they're diagnosed with HIV. So I know this client is immunocompromised, and it also says they have a cold and they're coughing up yellow mucus that's clear. So a client with HIV that has a cold, this right now is not the most critical patient, because all that I know about this patient is that they have a cold and they're coughing up mucus. Other than that, I don't see anything projected that could be wrong with this patient. So right now I have a patient that could possibly have an appendix burst. I don't know what's going on with the appendix. I know it just needs to come out. They're in severe pain and they have an irregular white blood cell count. Now, you guys, I need you guys to tell me that white blood cell count number. Is it too high at 20,000 or is it too low at 20,000? All right. So the client number 4, what's going on with this client? This client was diagnosed with a DVT. We're looking at who's the priority patient. This client was diagnosed with a DVT how many days ago? 3 days ago. So the patient diagnosed with a DVT 3 days ago, and they're reporting pain and warmth in the affected extremity. Pain and warmth in the affected extremity of somebody with a DVT. Is that going to be an emergency for me? Is that going to be an emergency for me as a registered nurse? You've been diagnosed with a DVT and you're telling me you have pain in the leg where the DVT is? No, this is expected pain. I expect you to have pain there. I expect you to have warmth there. All right. And you want to rate it a 10 out of 10, then that pain is just really bad. So if I'm looking at all 4 of these clients, my priority is going to be number 1. So the reasons why for me is because this is an unstable patient. They have not had the surgery yet. Also, their white blood cell count is way too high. It's way too high. So in your studying, I want you guys to ask yourself, I want you guys to look this up. What does it mean if a person has a white blood cell count that's really high? What does that indicate to you as the registered nurse? Also, how could that prevent our patient from having surgery, which is what they really, really need, right? So prioritization questions, you have to look at these clients as they are presented to you at that moment. I think I read that somebody said that to the client with the broken ankle, rating pain 10 out of 10, may be complaining of compartment syndrome. Well, that is a huge leap into what I have presented to me. All I have presented to me is that the client has a broken ankle. Compartment syndrome indicates that somebody has a cast on that's cutting off the circulation. We don't have that information. And so it's really essential for us as nurses not to get too deep into what is going on with the client, because we can really get ourselves caught up if we are thinking too deep about the clients. Okay, so look at what you have presented in front of you. All right, good job, everybody. Let's talk NCLEX. You're going to see this slide after every question. This is Let's Talk NCLEX. Let's do another question, okay? Let's do another question. Don't worry about it. Florida in the house. It's okay if you're just joining. We're just getting started. This is just getting good right now. Here's another question. A 25-year-old client presents with sweating, irritability, and weight loss. The client states she has hyperthyroidism. The healthcare provider reports the client to have a euthyroid. What does this mean? Number 1, an absent thyroid gland. 2, high levels of the thyroid hormone. 3, a normal thyroid gland. 4, an abnormal thyroid function test. Don't look it up. Do you know it or don't you know it? The client has all these symptoms of hyperthyroidism. She's sweating, irritability, weight loss. She states, I have hyperthyroidism. The healthcare provider reports you have a euthyroid. What does that mean? Are you familiar with this term? This is what NCLEX is betting that you don't know. And that is basic content of nursing. All right. So And here's why I love to do this. Here's why I love to do this. This is where content supports you during your exam, because if you get a question like this and it says the client has euthyroid, oh, there's no strategies that's going to help you to figure out what euthyroid means if you don't know it. All right. There's no decision tree. There's no hacks into the NCLEX. Either you know this or you don't know this term. And if you don't know it, it's okay, because I want you not to know it here. I want you not to know it here. The correct answer is going to be a normal thyroid. Yes. The majority of Remar nurses had it. Yep. You gotta know. You got to know your NCLEX content if you're going to take the exam. And your content knowledge is the easiest thing to fix. It's the easiest thing to fix. All right, let's keep going. I don't want to keep you guys long. We have been together for almost an hour. Let's keep going. And I am happy for each and every one of you that are here today. All right, just a few more questions. Let's do this. Okay. A client diagnosed with uncontrolled diabetes mellitus is admitted. Which of the following should be on the interdisciplinary team? Oh, I know you love these interdisciplinary team questions. So here we go. We're looking for who should be on the interdisciplinary team of a client with uncontrolled diabetes mellitus. Here we go. Number one, is it the podiatrist? Oh, and this is a select all that apply question. I didn't write that down. This is a select all that apply question. So there will be more than one answer for the interdisciplinary team members. Okay. So number one, the podiatrist. Two, the optometrist. 3, the psychiatrist. 4, the endocrinologist. And 5, the radiologist. Okay, we are looking for team members for the client with uncontrolled diabetes mellitus. What do we have here? What are you guys saying? Okay, just 4 endocrinologists. 1, 4, and 5. 1, 3, 4. Interdisciplinary teams. I'm telling you guys, I love to talk about this with students because they say, Regina, I need more questions on interdisciplinary team. So I wrote this one for you guys. All right. So the correct answer. Thank you, everyone. I see the answers. Some people are like, I don't know. This is select all that apply. Yeah, this is a select all that apply question. So there will be. I'm just giving you a hint. There's more than one answer here. There's more than one right answer. And I'm seeing everybody come in. Think about, and okay, let me give you the answer. The correct answer is going to be number 1, the podiatrist, number 2, the optometrist, and number 4, the endocrinologist. 1, 2, and 4. Yes. And let's think about it. When it comes to these interdisciplinary team questions, you want to anticipate the person that is going to help reduce the complications of the patient. All right. Based off the information that you know about them. All right. Based off the information that you know about them. So somebody with uncontrolled diabetes, why are they going to need the podiatrist? Why are they going to need a podiatrist? What is a podiatrist? I mean, let's start there. Do we know the definition? Do we know diabetes mellitus? Okay. If we know diabetes mellitus, then we know that there are certain potential complications that a diabetic will have. And one of them we see the podiatrist. One of them is that they're going to have that neuropathy, right? They're going to have a potential for having neuropathy, particularly in the feet, right? The foot care, the diabetic foot care is a specialty that they're going to need. They're going to need advice from, they're going to need recommendations, they're going to need guidelines. The registered nurse is not going to be able to provide all of that all the time. They're going to have to see a podiatrist for their foot care. All right, got to have that foot care. I like that. Okay, 2, The eye doctor. Yes, 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 yes. Retinopathy, diabetics, especially those with uncontrolled diabetes, sugar floating around in the bloodstream, that glucose floating around in the bloodstream is going to eat away at the eyes, okay? And that's why controlling your blood glucose levels is so important, because free floating sugar will damage a lot of your body. Okay, so the eyes, they're going to need their eye doctor. They're going to need eye care. If you guys got quick facts, if you got the 5-star quick facts, my best friend, you will have the section on diabetes there. Okay, so every nursing student should have this book. If you're watching this and you don't have this book, get this book. All right. And then also the endocrinologist. Yes. Did we forget that the pancreas is an endocrine organ, and the complications with diabetes mellitus is going to encompass the specialty of an endocrinologist, especially somebody with uncontrolled diabetes. They're going to be able to make recommendations on the best ways to care. All right. So, now let's look at the other choices and why they weren't appropriate. The psychiatrist, there is no indication that any mental illnesses are going on with this patient at the time. And then also the radiologist, you would not expect for frequent x-rays that need interpretations by a radiologist with uncontrolled diabetes. Okay, so cool. Good job, you guys. They got it right. Everybody didn't get it right, and that's okay. So some people are saying, oh, this was super easy, but everybody didn't get it right, which means that although you may be at a higher learning level, your classmates are not. So let's just be encouraging to everybody, okay? Let's just be encouraging to everybody. And right now, you can go, somebody just asked me this. You go to readmorenurse.com to purchase this book right here, okay? $29.95 was the question, all right? All right. Thank you. Hey, I got a nurse here, Nurse Alvarez. 1 week ago today, I passed NCLEX RN with 75 questions. Pow! That's great. Thanks to God and Remar. Guys, get Remar, invest in your future. I thank you so much. And then also get the 5-star, please. It's really good. Thank you. It's the updated version. All right, here we go. We are moving on. This is Let's Talk NCLEX. We got another question, and then maybe I'll let you go. I don't know. We'll see. All right, here's our question. So we're following along with this. Oh, this is a good one. Okay. A client diagnosed with uncontrolled diabetes mellitus is admitted. During education, the client asks, when is the best time to check the blood glucose levels? Which is the best response by the nurse? Is it number 1, when the blood glucose levels are highest? 2, when you will remember, do it immediately? 3, when you are most relaxed? Or 4, in the morning when you wake up? The client asks, when is the best time to check the blood glucose levels? Is it when the blood glucose levels are highest? 2, when you remember to do it immediately? 3, when you are most relaxed? Or 4, when you wake up in the morning? Oh, I see the answers coming in. Thank you guys for participating here. We are doing Let's Talk NCLEX. Brittany says, more questions. Come on. All right. Oh, so this is one of those questions where there's not a specific time period that's given, but references. Thank you guys for participating. So if a posed question comes up like this, the correct answer is going to be in the morning when you wake up. Yes. This makes the most sense because honestly, it's the only one that is connected to time. And you guys are saying yes, because you've been fasting all night, when should you check it? But if you look at the other options, and this is what NCLEX wants you to be able to determine, all of the other options are very, how can I say this? They're very unstructured. So if the nurse answers, well, when the blood glucose levels are the highest, the client may interpret that to be, well, when is that? Like, is that after I eat? Is that before I eat? When do I do it? Like, 2, when you remember, do it immediately. And the client's like, okay, whenever I remember, I guess I'll just check my blood glucose levels. That's not going to be great. And then 3, when you're most relaxed. Well, when is that? I mean, that's so very subjective. Is it, after you've eaten? Is it when you're watching a movie? Then, so number 4 is really the only one that makes sense, because it's like, okay, when you wake up in the morning, check your blood glucose levels. When you wake up in the morning. So I got some good news. Everybody that participated got that right. So that's a great indication that you guys understand the principles of blood glucose checks, insulin administration, consistency when you are a diabetic. So great. And this is how NCLEX questions help us to determine our level of knowledge. Now, they don't teach us anything. We have to do the studying work, but they will be a reflection of how well you know something. All right. How well you know something. So yeah, they were very, very vague. Okay. All right. So, I have another one. And I'm really happy about that, because sometimes when I'm doing these, I think, oh, this is getting too long. And the nursing students, they're not going to want to, they don't want to be here all day. But so I have another one. This may be the last one. Let's do it. Okay. A nurse is administering packed red blood cells to a client. Which of the following are signs of a hemolytic reaction that can be seen in the first 15 minutes of blood administration? All right, so you guys know what time it is. So we're looking for signs of a hemolytic reaction. Here we go. Number 1, hypertension, bradycardia, and painful IV site. 2, chills, hypothermia, leg pain, anxiety. 3, hypothermia, vomiting, rash, hypertension. 4, tachycardia, chills, fever, hypotension. Oh, this is a divider. This is a divider right here. We're talking about the signs of a hemolytic reaction to blood, right, within the first 15 minutes. Ooh, here we go. Number 1, are you going to see hypertension, bradycardia, painful IV site? Are you going to see chills, hypothermia, leg pain, anxiety? Are you going to see hypothermia, vomiting, rash, hypertension? Or 4, are you going to see tachycardia, chills, fever, hypotension? Oh, this is a good one. Oh, this is a good one. And I say this is a good one because if you think about what happens during a hemolytic reaction, how does the body respond? Well, the body responds like the person is in shock, right? You have a shock kind of response. So when the body is in shock, how does it behave? How does it behave vital signs wise? When your body goes into shock, what do your vital signs do? And I know if you have the DVD package and you did this with me, then I know when we talk about, I'm trying to think of what the exact topic was. Oh, when we talk about diabetes mellitus and I talk about the shock there, what do the vital signs do when your body is in shock? Is your blood pressure going up? Is your blood pressure going down? Is your heart rate going up? Is your heart rate going down? That will lead you to the answer to this question easily. All right. Yes. So irregardless of all these other things, if you just look at the vital signs, you can pick the right answer. And that's what I mean when content carries you through your NCLEX exam. So, ladies and gentlemen, the correct answer is number 4. All right. So you're going to have a tachycardic reaction because your blood pressure goes down during shock, right? The patient will also have chills and a fever. So the temperature is going to go up. Did you get this one right? Did you get this one right? All right. This was very, 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 and this is a perfect picture of how NCLEX is really based off of your client's safety. Like during an emergency, are you going to know how to respond? Are you going to know what to anticipate, right? So take out your notes if you guys didn't get this one right. Here's something I wanted to share with you. Let's see if I can make it big. Okay, so for the hemolytic reactions, an immediate onset is seen usually within 15 minutes. The reaction signs can range. They can range from not so severe to very life-threatening. But what you will find is the chills, fever, lower back pain, tachycardia. The skin may have a flushing tinge to it. That blood pressure is going to go down. Chest tightening or pain as well. Tachypnea, nausea, and hemoglobinuria. All right. Hemoglobinuria. All right. Okay. All right. So I'm getting a protest here where people are saying you cannot end this broadcast. And I don't know. Do I have another question? I don't know. Okay. I'm late today, but I just want to let you know I passed NCLEX on Wednesday, the 13th of March. Hey, thank you, Nurse Walker, for coming on here and telling me that. Thank you so much. It doesn't matter if you're late. Testimonies are welcomed at any segment. And it's okay. For you guys, thank you, Nurse Walker. For you guys who did the last question and you didn't get it right, all is well. So anyhow, I can pull out another question. All right. So let's do one more. Let's check it out here. Okay, here we go. One more question. This is the last question. Participate. Okay. All right. Here we go. A nurse is caring for a client receiving ciclosporin. The client's uric acid levels are elevated, which is an expected complication. Again, a nurse is caring for a client receiving cyclosporin. The client's uric acid levels are elevated, which is an expected complication. Number 1, the development of biliary stones. 2, the development of jaundice. 3, the formation of crystals in the kidneys. 4, the development of muscle wasting syndrome. I apologize. The development of muscle wasting syndrome. Here we go. We got a medication question. I know you guys love that pharmacology. This is a typical medication question for NCLEX too. I would just like to say that. The answers are coming in. Come on in and participate. Comment on this video. 2,000 comments. Wow. Right? All right. So great job, everybody. It's okay. Give it a try. Even if you're not sure, give it a try. Okay. If you had to pick one, which one would you pick? Which one makes the most sense? Which one makes the most sense based off what you know? Okay. The correct answer is going to be number 3, the formation of crystals in the kidneys. Oh, yes, kidney stones. And let me say this. I put it down at the bottom for you guys to read. This is an NCLEX question. Although the medication is highlighted, this question is not about the medication. Also often when I'm doing NCLEX questions, they will present a medication and really it will be a distractor, okay? Because the real meat of the question is the details following the medication. And so students oftentimes, they say, Regina, there was medications on the exam I never heard of, I never seen before, and I just lost it. I just freaked out. And I have to tell you guys, pay attention to the rest of the question. Sometimes the medication is really a distractor because look, we got the best of the information after the medication name was given, okay? So after the medication name was given, when we see cyclosporin, you might think, oh my goodness, I don't know what that is. I can't even remember. But then they give you the answer. They say the client's uric acid levels are elevated. So this question now turns into what is an expected complication of high urea, high uric acid levels? Oh my goodness. Oh my goodness. So this question is not about the medication. It's not even asking us what the medication does. It's telling us what is the result of the client's condition. And so exactly. Somebody said, I don't even know the drug. I just base my answer off of uric acid. Exactly. When you have too much uric acid in your body, the body compensates by creating stones. And the stones are normally going to be held where? They're going to be held in the kidneys, right? So they're going to be kidney stones because you have high uric acid levels. And you guys have to understand what causes high uric acid levels in a person? How are kidney stones treated? How do you treat kidney stones? But here, I just really like this question because it was not about the medication at all. But I know that somebody may have been tripped up by the medication. And so I wanted to present this to you guys. So while you're taking the exam, you can calm down if you see a medication question, all right? And try to work your way around it based off of what? Is it based off of strategies? Is it based off of what so-and-so said about how they got through their test? No, it's based off of what you know as a nurse. You guys are clinicians, okay? So this exam is going to really hone in on that foundation. Yeah, no, biliary stones was a trick. All right, because they're not biliary stones. All right, and I love this comment. Nurse Jessica said, 5-star quick facts is a must-have. You got to have it. and the reason why quick facts is so great, to be honest, is because literally there's nothing in this book that isn't core content. It's all core content that you can build. And when I'm writing these questions from you guys, I have out the quick facts because it's like, I can write great NCLEX questions based off this information in here, you know? So a shout out to you guys that participated. Shout out to you guys that participated in your Motivational Monday, your Let's Talk NCLEX this week. I'm going to cut it here because we have done questions, and the whole goal is for me to come on here and to just let you guys know, affirm you can do it. You will do it. All right. Before I go though, we have to announce our winner for this week that we're paying for their NCLEX exam. It's been such a pleasure. All right. So our winner, Nurse E. Rodriguez, future RN, and she's in Grays Lake, Illinois. I think maybe one of our first winners from Illinois. I don't know. But I was so excited because normally you guys know that we definitely have a representation down south, West Coast, PR, Jamaica. So it's really cool to see a new winner who made the investment in themselves. They got that DVD package. And I love the comment that I just read. Don't just get quick facts, get the whole package. But future Nurse Rodriguez got the DVD package. And so she is going to be getting her NCLEX paid for. Shout out to my nurses in the Philippines that are watching this. I appreciate the love that you guys show all the time. Yes, you can just purchase the Quick Facts book by itself. But hey, if you have any more questions about your products or what's best for you, check out my email, support@remarreview.com. Send me your questions there. We do love helping you. I know I get a lot of testimonials there. I'm still checking for the videos. If you're passing NCLEX, don't just jump on here and tell me that you passed. Don't just jump on here and tell me that you passed. I want to see your video so that you can give your testimony. And really, the videos are a way to give back to the Remar community, because the nurses that are testing, that need motivation, that need strength, they watch those testimonials and your story about how you overcame your struggles. Everybody's struggle is different. Encourages the next group of Remar nurses that are coming up behind you. When you get up and get your license, turn around, stick your hand out and pull somebody up there with you. That is what our mission here in the Remar family is to do. Okay. So the Remar website there, check it out. You will be able to get your NCLEX resources there. We have the testimonials. We also have links to the YouTube, Instagram page. Don't forget the podcast, Remar Radio, where you can just hear more and more of my voice, right? You just hear more and more of my voice. I know some of you guys are like, Regina, you're programmed in my brain. I hear your voice all the time. Well, that is how it's supposed to be when you're trying to get your NCLEX exam. You need the best motivation, the best NCLEX information. And we have that here at Remar Review. So I saw that there are some people who are testing this week, testing soon, right? And I know that prayer is so important. And so I'm going to ask Elder Mark Callion spontaneously to come up and pray for us. Is that okay? You guys, is that okay? Because I know, and if you're praying, let me see your name here. If you're wanting prayer, just put your name in, type your name in for prayer. I'm going to ask Mark to come up here and pray. And he wasn't expecting this, but that's okay. Because when you have that belief and you have leadership, then you can be called upon at any moment to pray. So I'm going to have Mark Callion come up. And we can, yes, we can, we will, we must pass NCLEX. Absolutely.
You slide in here.
Hey!
What's up, everybody?
It's Mark.
How are you all doing? I've been watching from behind the scenes.
Yeah.
I see all the names coming in.
Yes.
And so the prayer that we're going to give today is going to be a very simple and concise one. And it's a theme that I've been seeing just as we've been looking at the comments and that you've been answering and responding to. And so what I'm going to pray for now is to pray for your decisiveness. Your decision-making ability. So many people have asked, well, should I get this or should I do that? Or I think this is the right answer. Should I think that is the right answer? Or, I've been out of school for a while. Should I retest or what should I do? Where should I start? And oftentimes all it comes down to is just making a decision. And so we're going to pray for your ability to make the right decisions, whether it's for taking NCLEX and that you're answering the right questions or preparing for NCLEX or ordering your steps in terms of being in the will of God, so that you would just make the right decision and be able to move forward and free yourself from indecision or indecisiveness, so that we can take control in your life in that area of making decisions that are going to benefit you, your family, and everybody, and influence everybody around you. All right. So when you have disruptions are easily cleared up when you're able to make decisions. All right. So let's go ahead and pray.
Okay.
Father in heaven, thank you once again for your students, your nurses, your children that are preparing for their NCLEX exams. Sometimes they may have just heartache, Lord, to say, okay, what should I do? Will this work out for me? Is this your will? But I ask, Lord, that you would just give them the supernatural ability right now to be able to answer those questions, and that you would answer those questions that they stand in need of, Lord. Whether they feel that they're prepared or not, give them the ability to make a decision to be prepared. Whether they feel like they can take the next steps, Lord, give them the ability to make that decision, that if this is the direction that you want them to go, that they will stand firm in it, they will be confident in it, then they will walk in that, knowing, Lord, that you are with them. Lord, I ask that they would just be able to have a firmness of foot and a stillness of heart, so that as they move forward, they will be able to have peace in the process, because you promise to give a peace that surpasseth all understanding. So even where there are questions, where there is doubt, I ask, Lord, that your Spirit would take over and give them the peace of mind to make the right choices and be able to move forward, and knowing that you are that good shepherd, and that with you that we will have no want, no lack, and nothing shall be desired that you will not provide to us if it is good according to your will. So this is our prayer, Lord. Bless those that will be testing, bless those that are in the process, and may we all do so according to your glory and honor. In Jesus' name we pray. Amen.
Amen. Thank you, Elder Mark.
Thank you.
Thank you.
It's an honor and a pleasure. Mwah.
Oh, thank you. So now I have to start blushing uncontrollably. So anyways, you guys, we will meet again next Monday for Monday Motivation. Let's talk NCLEX. It was a pleasure. It was such a pleasure today joining you all here. I'm excited for next week already. I already have the questions in my mind that I want to do. It's going to be amazing, amazing, amazing. If you are in the Remar Nurse Study Group, continue to motivate, encourage, uplift each other. That is such a positive place where you're able not only to practice questions with your peers, but also just congratulate and see all the testimonials. God is good, and he's doing miracles right now for our Remar family. So stay blessed. Remember this week, and not analyze the disruption. Analyze it, all right? And use it for development. So you guys, you know this. You can, you will, you must pass NCLEX. We can, we will, we must pass NCLEX together. See you guys later. Bye-bye.